So now for more on what we've heard from the premiers at their healthcare summit, I do want to bring in Dr. Michael Gardam. He's the CEO of Health PEI, and he's joining us today from Charlottetown. Thank you so much for making time for us.
Thanks for having me.
So we heard from the premiers last hour, and they were discussing primarily healthcare. They said that was the top topic of this discussion. What do you think is the value of this sort of a collaborative talk between these particular premiers, given the fact that, of course, it's very specific to each jurisdiction?
Well, I think there is definite value in realizing that everybody is facing the same challenges. And I personally am very encouraged that we're not hearing the rhetoric we might have heard a few years ago about how we have the best healthcare system in the world and nothing needs to change. I think, the pandemic has really highlighted that the Canadian healthcare system is in real trouble. And the fact that our politicians are really talking about that now, I see as a very positive first step.
So, you say there that the healthcare system is in real trouble. We didn't really get a lot of specifics from the premier. Certainly we heard, for example, from where you are, Premier Dennis King was saying that he has an opportunity to really sit with a lot of the leaders in healthcare have them all at the same table and have that discussion. Whereas, of course, you're very familiar with in Ontario, that would be much more difficult to do, just given the sheer size of those two provinces and the challenges they face. But in terms of solutions, and what you heard from the premiers, is there anything that actually sounded like it may work?
Well, we've been working very, very closely with the Premier's office and others in government, and you're absolutely right. PEI is very small, and it's one of the things that attracted me here is because we can change things much easier than much larger provinces. And so we've been working very closely with a number of different groups. We have a huge long list of various things that we can change. And right now we're focusing on increasing scope of practice and making sure that people get paid for additional work that we're asking them to do. We're looking at really enhancing primary care, looking at how we can use nurse practitioners more efficiently, looking at how we can free up parts in our budget to take advantage of hires, et cetera. So one thing I'll say about PEI is that we have been able to mobilize very, very quickly. And for me, I'm actually quite encouraged that a year from now, we're going to be in much better shape.
So that is promising, of course, from where you are. There were a number of premiers who were there, though, looking at this. And we, of course, know that this is a problem across the country. How are you looking at it? I know it's not like you're not paying attention to what's happening in the rest of the country. So how are you looking at the other provinces, given the fact that PEI's situation is somewhat unique?
Yeah, well, we definitely look at the other provinces. And one thing that, I think all of us healthcare leaders are looking for is we need detailed, deep conversations and really deal with those so-called wicked problems rather than, simple solutions for complex problems, which end up not working very well. So I'm really looking for, what are other provinces doing, not just sort of superficial stuff, but really getting into it. And, so far I haven't heard anything that we haven't thought of here in PEI, but obviously we want every province to be in better shape, especially for PEI, because we are dependent on other provinces for some of the care that we provide. We don't have cardiac surgery on the island. We don't have neurosurgery on the island. There's a number of subspecialty things that we are reliant upon other provinces to help us with. So we all need to get better.
Let's talk solutions for a moment, because certainly when you talk to whether it's frontline workers or those who regularly are in discussions with frontline workers, compensation might be one thing that is discussed. So do you think that is one way to address it? If wages are increased, are we not going to see the sort of labor shortages that we're having now, or the sort of, it wouldn't help necessarily with the exhaustion, would it?
No, that's exactly it. I would say we need to do both of those things. We do need to increase wages because the fact remains that, the market is really geared towards people, to the frontline workers, and we need to pay them for the work that they're doing for us. At the same time, though, if you look at all the literature out there, what people really want is to feel, seen, heard, respected in the workplace, to have a voice, feel like they're part of something bigger. That's frankly more important than money. So I worry about throwing money at healthcare workers. We can't stop there, because if we don't fix the issues within our system, all we're going to do is have slightly better paid but still burned out healthcare workers. It's a really short-term solution. We need to do both.
And now I think we touched on this during our discussion, but one of the hot button issues is privatization and whether it could help relieve pressure on the public system. So we know in Ontario, Doug Ford proposed using public funds to pay for procedures at private clinics. In your opinion, could increased privatization take pressure off the public healthcare system?
Only if you find more healthcare workers, right? I mean, if you're sending somebody somewhere else, somebody has to care for them. And so where are those healthcare workers coming from? I think one of I guess the pitfalls when we discuss Canadian healthcare is we tend to immediately go towards privatization. There's a lot of other stuff we should be talking about as well. I'm not suggesting that those couldn't be solutions. I'm saying we need to really think carefully whether we're actually going to get the biggest bang for our buck, or whether we're simply going to starve the public system in order to get better access for people in another setting. There are circumstances where if you have a very specialized private clinic, you could provide care more efficiently. Maybe you can do more with less, but those things need to be really worked out. And that's the kind of work that we have to do going forward.
You know, we were speaking to a patient in need of care who is located near Sault Ste. Marie in Ontario earlier today in the program. And he essentially said that he's feeling a lot of anxiety because they do not have adequate health care where he is. And that's something that shifted. He called it night and day during the course of the pandemic. He was suffering from heart palpitations and in fact was recommended to go to get a CT scan, which he went to do. He can't access the results of that and says so many people in his community are just relying on sort of Google diagnosis now. They're just Googling their symptoms because they can't have access to care. What do you say to people who are in that position, who are really worried, concerned, scared?
Yeah. I mean, I certainly do feel for them, and that's something that I never stop worrying about here, right? It's, you know, I think, as I said in the beginning, we're in a good place, in fact, that people are talking about that we have problems, but those fixes are not going to come right away. And I really do feel for people. It is very frightening, especially here in PEI. We've had a number of people move here from other parts of the country. And their first question is, why can't I get a family doctor? And well, there's a long list of people who are waiting for a family doctor. And unfortunately, if you just arrived here, you're at the bottom. And so these are really, really important issues, which is why here in PEI, the Premier and others, we're really focusing on access to primary care. I think for decades, we've talked about hospitals. Those are important. And we have to have access to very good quality primary care. And that's what people like that patient you're talking about, that's what they're missing. And that's what we're trying to fix here.